Stomach illnesses spreading through drinking water, swimming pools, or even fresh produce? If you're over 60, this isn't something to ignore. Today, I want to talk about a microscopic parasite that has quietly become one of the leading causes of severe watery diarrhea outbreaks across the United States. The surprising part is that many people have never even heard its name, yet it can survive in places most germs cannot. Before you assume this is just another stomach bug, stay with me, because one fact about how this parasite spreads catches many families completely off guard. I'm Dr. William Lee, and one of the most important lessons in medicine is that the smallest organisms can sometimes create the biggest problems. The parasite we're discussing is Cryptosporidium, often called crypto. It spreads through microscopic amounts of contaminated stool that reach water, food, or surfaces. Unlike many bacteria and viruses, this parasite is protected by a tough outer shell that helps it survive in the environment. Research from the Centers for Disease Control and Prevention and numerous public health investigations has shown that crypto has caused outbreaks linked to swimming pools, splash pads, untreated water, and even fresh produce. That doesn't mean every pool or glass of water is dangerous, but it does mean awareness matters. Here's what makes this especially important for older adults. As we age, our immune systems naturally become less responsive. Chronic conditions such as diabetes, kidney disease, cancer treatment, or medications that suppress immunity can make recovery more difficult. While many healthy adults improve within a couple of weeks, some people experience prolonged diarrhea that leads to dehydration, weakness, dizziness, and hospitalization. Those complications, not just the infection itself, can become the real danger. The first symptoms often seem harmless. You may notice frequent watery diarrhea, stomach cramps, nausea, fatigue, or a low-grade fever. Because these symptoms resemble food poisoning or a common stomach virus, many people never realize a parasite could be responsible. That's exactly why delays in diagnosis sometimes happen. And there's one symptom many people overlook that may signal dehydration is becoming serious. I'll explain that in just a moment. One question I hear often is, if my tap water is treated, am I still at risk? The answer is reassuring but not simple. Public water systems in the United States are generally very safe, yet no system is perfect, and outbreaks can occasionally occur. Private wells, untreated water sources, recreational water, and accidental swallowing of pool water can present greater risks under certain circumstances. Understanding where exposure happens is far more useful than living in fear. The good news is that there are practical steps that dramatically lower your risk. Washing your hands thoroughly with soap and water after using the restroom or changing diapers remains one of the most effective protections. If you're swimming, avoid swallowing pool water, and if you've recently had diarrhea, stay out of pools until you've fully recovered. These simple habits may sound ordinary, but they interrupt the parasite's ability to spread from one person to another. In the next part, I'll explain why this parasite can survive chlorine better than many people expect, the warning signs that mean you should contact your healthcare provider immediately, and the everyday mistakes that increase exposure without most families realizing it. Knowing those details could make the difference between a short illness and a much more serious medical emergency. As we continue, let's answer one of the biggest questions people ask. Why doesn't ordinary pool chlorine always stop this parasite? The answer lies in its remarkable protective shell. Cryptosporidium forms an outer coating that allows it to survive much longer in chlorinated water than many bacteria and viruses. That's why public health experts emphasize that chlorine alone isn't enough if someone with diarrhea enters a pool. It only takes swallowing a tiny amount of contaminated water to become infected. Most people never imagine that something invisible could spread so easily. Yet this is exactly why health departments investigate recreational water outbreaks so carefully. Another surprising fact is that symptoms don't always begin right away. After exposure, it may take several days before diarrhea suddenly appears. By then, many people have forgotten about the vacation, swimming trip, or picnic where they may have been exposed. This delay makes it harder to connect the illness to the real source. If you develop severe watery diarrhea lasting more than a few days, especially with signs of dehydration such as dizziness, extreme thirst, reduced urination, or confusion, don't simply assume it's a routine stomach bug. Your healthcare provider may recommend testing a stool sample because parasites require different evaluation than many viral infections. One mistake that concerns physicians is relying on antidiarrheal medicines without understanding the cause. While some medications can help certain illnesses, they may not always be appropriate, especially if symptoms are severe or accompanied by fever or blood in the stool. The safest approach is to stay hydrated and seek medical advice if symptoms become intense, persist, or occur in someone with a weakened immune system. Early medical evaluation can prevent complications that become much harder to treat later. Hydration deserves special attention because diarrhea causes your body to lose both water and important minerals called electrolytes. These minerals help your muscles, heart, and nervous system function normally. Losing too much too quickly can leave older adults feeling exhausted, lightheaded, or unsteady on their feet, increasing the risk of dangerous falls. That's one reason doctors take prolonged diarrhea seriously in seniors, even when the infection itself is expected to improve. Fortunately, there are effective ways to reduce your risk. Wash your hands thoroughly with soap and water, especially after using the bathroom, changing diapers, gardening, or handling animals. Rinse fresh fruits and vegetables before eating them. Avoid swallowing water while swimming, and be cautious with untreated water when traveling or camping. If you have diarrhea, protect others by staying out of pools until you've fully recovered. These simple habits may seem small, but together they create a powerful barrier against infection. Before we finish, there's one more important point many families overlook. Not every episode of diarrhea is caused by Cryptosporidium. Viruses, bacteria, medications, and other digestive conditions can produce very similar symptoms. That's why guessing the cause at home isn't always safe, particularly if symptoms are severe or persistent. Knowing when to seek professional care is just as important as knowing how to prevent infection in the first place. So, what should you remember after watching today? First, don't panic, but don't ignore persistent watery diarrhea either. Cryptosporidium is a real parasite that public health agencies continue to monitor because it has caused outbreaks linked to contaminated recreational water and other exposures. Most healthy people recover, but older adults and individuals with weakened immune systems face a greater chance of dehydration and complications. Recognizing symptoms early and staying hydrated can make a meaningful difference. Second, prevention is far easier than treatment. Good hand hygiene, safe food handling, avoiding swallowing recreational water, and paying attention to symptoms after travel or swimming are practical habits supported by years of public health research. These aren't dramatic or complicated steps, but they remain some of the most effective ways to protect yourself and the people you love. Finally, remember that your body often gives warning signs before a minor illness becomes a major problem. Persistent diarrhea, dizziness, confusion, severe weakness, or signs of dehydration deserve prompt medical attention, particularly if you're over 60 or living with chronic medical conditions. Acting early may help prevent hospitalization and support a smoother recovery. I hope today's discussion has helped separate facts from myths while giving you practical information you can use. If this video taught you something new, let me know in the comments whether you had ever heard of Cryptosporidium before today. Have you or someone in your family experienced a severe stomach illness after swimming or traveling? Your experience could help other viewers recognize important warning signs. If you found this information valuable, please like the video, subscribe for more evidence-based health updates, and share it with someone who would benefit from knowing how to stay safe. Thank you for watching, and I'll see you in the next video.